Hi, welcome to the COVID-19 Lake Norman and North Mecklenburg briefing call. Today is Monday, April 27th. My name's John Bradford. I'm your briefing call moderator. I'm a small business owner, 2 businesses right here in North Mecklenburg. I'm also a former member of the North Carolina House of Representatives. The purpose of these series of calls has been to bring together healthcare experts, government officials, and business leaders to provide regular COVID-19 briefings to update, educate, and support the North Mecklenburg region during the outbreak. We are still under President Trump's announced social distancing required guidelines through April 30th. And as you can see on your screen, social distancing does work. It does help reduce and flatten the curve. So please continue to be smart and exercise social distancing, which is at least 6 feet away. The President and CDC and the White House have announced some guidelines for opening up America again. The idea is it's a 3-phased approach. It focuses on symptoms of a downward trajectory, in symptoms, a downward trajectory of cases, and then for hospitals, making sure there's a robust testing program in place for all the healthcare workers and a variety of other things. President Trump did sign the stimulus package bill of $484 billion on Friday. That's $320 billion for the payroll protection program, $60 billion for the economic injury disaster loan, $75 billion to hospitals and healthcare providers, and $25 billion for additional state-level COVID testing and research. LabCorp, we've talked about this, but it was news over the weekend, so I just wanted to mention again, LabCorp, which is a North Carolina-based company in Burlington, is selling an at-home test kit. This was received, it was fast-tracked with the FDA. It's called the Pixel. It's a $119 test, and it includes the collection of specimens using nasal swabs. The test is being marketed first to healthcare providers and our first responders, but consumers can buy the test if it's recommended by your healthcare provider and after you fill out a questionnaire. So this is a great example of North Carolina strong and North Carolina proud at work here. If you are interested in ordering some face coverings, cotton cloth coverings are still being recommended. One company, another North Carolina company, is called Indira Mills, shop.indiramills.com. You can see their website on the screen and their logo. It's around $2 a mask. You have to buy at least 12 of them, 1 dozen. I have some of these masks. Lots of people who listen to our calls have ordered them. These are machine washable, and I wear it and I have no problem. I don't feel uncomfortable, and I feel like it does a great job of covering my face. So if you need some, please order some through Indira Mills. From the United States, this is from CDC. As of April 25th, we had 928,000 cases with 52,000 reported deaths. Of course, this data is from the 25th, so it's already a little bit old. So I'm sure these numbers are slightly higher. As you can see from the heat map, North Carolina is not one of the darkest color states. In fact, North Carolina and South Carolina and Tennessee and Georgia all seem, Alabama seem to be on parity. Florida and Georgia seem to have higher number of cases. But you can see the heat map and look at the color schedule to the right. FEMA rumor control, there's lots of rumors out there. I always like to remind everyone, please don't be scammed. If someone is trying to get your private information with the intent they want to send you money, they are scamming you. The IRS and the Department of Treasury, they know who you are. They will get you your money. If you want to go to this website, please do. I always check it for new rumors. And there is a new rumor today. The rumor is FEMA seizing medical supplies? And the answer is no, FEMA does not seize any type of personal protective equipment from state or local governments. If a hospital believes that something was seized on them, they need to report it to their governor. If the governor believes that this has happened to their supplies, then of course the governor's office can report it to FEMA. The Department of Justice has assembled a COVID-19 hoarding and price gouging task force to identify any cases of price gouging, and of course may alert FEMA to some shipments and stockpiles of protective personal equipment. So just know that we're trying to stop the price gouging. That's what FEMA is doing, but they most certainly are not seizing medical supplies. In North Carolina, we're under a state of emergency. As we talked about our last call, that's been extended through May the 8th. Here's a 1-800 number hotline. You can also use 211 on your cell phones for updates. As of this morning, we have 9,142 confirmed cases in North Carolina with 306 deaths. That's up from Friday, which was 269 confirmed deaths. In terms of hospitalizations, Friday, we were at 477. Today, we're at 473. So that number is, almost the same. And in fact, it went down a few. The number of counties has held at 93 for quite some time, but that number did increase now to 95 counties. So we have 95 out of North Carolina's 100 counties with a reported case of COVID. The biggest news since our last call was on Friday, late Friday, Governor Cooper announced that North Carolina Public Schools, along with Mark Johnson, public schools K through 12 will be closed for the remainder of the 2019-20 academic year. Now, they're physically closed, but remote learning will be ongoing. So the virtual learning, the distance learning is still very much in effect through the end of the school year, but the schools physically will not be opening up. Also, there's a new grading system that's been implemented. Elementary school students won't get a final grade for the semester. Instead, teachers are going to provide year-end feedback to help with student transition for next year. Middle school students are either going to get a pass or a credit or a non-credit. They're calling it PC-19 for credit or WC-19 for no credit for the final course grade on how they were performing on March 13th. And high school students in grades 9 through 11 can choose the pass credit or the non-credit grade or a numerical grade for their final courses. So this does get a little bit confusing. Just work with your school personnel, but there are some options rather than the numerical grades for pass versus for getting a credit versus not a credit for middle school, specifically for high schoolers as well. The state order, as we talked about, has been extended through May 8th. There's 3 phases. We are in phase 1. And so we will enter into phase 2 after phase 1 is satisfied, and then phase 2 is expected to last a couple weeks. And then after phase 2, if that's satisfied, then we'll go into phase 3, and that could be in a couple more, another 4 to 6 weeks. So we're only in phase 1 right now, but it is a 3-phase approach. If you're a volunteer, if you want to volunteer and you're a healthcare provider, you can go to this website. And if you need state unemployment benefits, there's another website right here you can go to as well. There's a lot of volume, so be patient. But the website is here. And employers can go here too if you have any questions. Mecklenburg County, we're at 1,471 positive cases and 40 deaths. And the county stay-at-home order is in effect through May the 8th, just like the state. And Mecklenburg County parks are closed to vehicular traffic. Walk-in and bicycles are still allowed. So you can still walk and ride your bike. And if you're going to these parks and you're parking on side roads, just be careful not to double park so emergency vehicles can get through. I'm seeing a lot of infill roads jammed because no one can get into the parks, so they're parking along the side of the street. So please be respectful and cognizant of where you're parking. Heat map from Mecklenburg County. This is as of April 22nd. It looks like Huntersville is 21 to 45 cases. It looks like Cornelius is 46 to 59 cases, and Davidson is 5 to 20 cases. We have Congressman Greg Murphy. He was going to join our call, so hopefully he's on. Congressman, are you on today?
Yes, I am, John. Thank you.
Wonderful. Thanks for joining. I know you've been busy. I know you couldn't be with us for a couple days last week with what's going on and passing the bill, so we'd love to hear what's going on from you, sir.
Yeah, thanks, John. Thanks again for doing these updates. On Thursday, we went back to Washington, D.C., a quorum, a majority of which did, and in line and in time sequence, we voted on another $480 billion plus addition to the payroll protection program. That was a very, very popular initiative. Over 1.6 million loans were given out to small businesses in the United States, the average of which was about $240,000. Everybody remembers 75% of that loan is supposed to go to protect your payroll for your employees. 25% can be used for rent, utilities, or mortgage interest. And if those terms are met, then at the end of 6 months, the loan is forgiven. I mean, it essentially becomes a grant. It's helped so many businesses, but the popularity exceeded its ability to fund it. And so that's why we had to come back and add essentially more money to the pool. I am concerned at this point in time, it's only at some point we can't keep printing money. And so it's going to be difficult. Such as the transition, many states are now using the data that we've learned from other countries, from other parts in our country to slowly start rebuilding our economy. Again, using social spacing, wearing masks, sanitizing. I think there is a path forward for us to do that. That's what's going to pull us out of this, not only medically, but economically. and bring us back on the path road towards some semblance of normalcy. So we're working hard, and I'm sure there'll be more work to be done in Washington, D.C. as we go through this crisis. Thank you, John.
You bet. Thank you, Congressman. I always like to remind our listeners that Greg Murphy's from the 3rd District, North Carolina, but he's a Davidson College alumnus, and he's a practicing physician, and in fact, the only practicing physician in Congress. So it's been great to have him on our calls. Thank you very much, Congressman.
Thank you so much. Stay safe.
Of course, you bet. Stay safe. And this is just a reminder. You see, we always have the U.S. Small Business Administration, Thomas Stith, who is the North Carolina State Director. He joins our call every Wednesday. So he'll be on our call this Wednesday. Here you can see 2 websites for help regarding these types of loans, the Payroll Protection Program and the EIDL loan. So now we're going to move to, we have a local doctor, Dr. Jack Fairclough. He has been on the ground. He's a local doctor, and so we enjoy having him as a panelist. Dr. Fairclough, love to get an update from you, sir.
Sure. Thank you, John. Yeah, so I think we should start with the testing update, since that's the main way to reopen our economy. So this week, they published data that we have conducted 1.5 to somewhere close to 2 million diagnostic COVID-19 tests this week. And we have the potential for doubling this in the next several weeks. So diagnostic testing production is coming around. It's still slow and still very limited, but it's moving. Antibody testing is here, but it's inaccurate. There's a lot of false positives with these. Some of them are up to 5%. So when the incidence of COVID-19 in some areas is estimated at 5 to 10, sometimes 15%, we'll have as many false positives as true positives with some of these tests. So antibody testing is here, but even further behind than diagnostic. The vaccine is really the main way to open the economy completely. And as of today, we have 92 vaccines in development. So that is encouraging. 22 of these are what they call fast-track vaccines, which are made with brand new technology using DNA or RNA as the base. And the problem with this, John, is that they've never panned out in medicine before. So we've tried DNA and RNA-based vaccines for hepatitis C and for malaria through the years. Nothing's panned out with those. So out of the 92 vaccines being studied, 22 are in this category. That's a big will see. So we're encouraged that a lot of people are spending a lot of money, and that potentially we'll have a vaccine in still 12 to 18 months. Treatment updates. Hydroxychloroquine got a lot of press in the beginning, but now we have enough science to say it's probably as dangerous as it is helpful, so it's not being used a lot. The antiviral that's called remdesivir, which was the most promising antiviral drug to stop the virus, didn't do well in a Chinese study, so that one doesn't look like it's going to pan out. And then there's a whole new shift in ventilator appreciation and utilization. So you'll hear that we're okay in ventilators a lot more. Turns out that the science says that ventilators aren't the best way to treat COVID-19. So I'll use a study to talk about that. There's New York's largest hospital system showed that 88% of those people put on a ventilator died if they had COVID-19. What was striking is that 97% of those that were older than 65 and on a ventilator died. So we've learned a lot. We've learned that this pneumonia that is COVID-19 is very unique. We have to be very nuanced with the way we use ventilators. We're now relying on things like CPAP and BiPAP, which are treatments for sleep apnea, a lot more than ventilators. We're using oxygen through nasal cannula a lot longer than we would have. We're tolerating a lot lower oxygen levels because there's something about a high pressure, high oxygen ventilator treatment that is sometimes harmful. So that's made our supply of ventilators a little better than we thought. The virus is more widespread. There's an antibody study in New York said that 20% of those living in the city, 21% actually, already had the markers of having had the virus. That put the case fatality rate down to 0.6% for coronavirus in New York, and that's on par with influenza, as we said before. Those most at risk, just ending from a scientific view, are still the elderly, those with chronic illness. But it's becoming more and more apparent that minorities are more at risk and should be added to that high-risk category. Basically, John, the big question on everybody's mind is how do we open up? And from a medical community, what I see that's happening in our clinics and our hospitals is that we're ready for a three-phased opening. We really should follow the lead of countries like Sweden that have shown that if you leave the young and healthy out in a social distance pattern, that we can keep the numbers down and we can also keep the economy going, which has huge health benefits. So that's my take, and I'm happy to answer any questions if anyone has them in the future. So thanks a lot, John, for doing this.
Yeah, you bet, Dr. Jack. We appreciate your leadership, and thanks for doing what you're doing. And please extend our appreciation to all your colleagues who are also on the front line there. So thank you. Moving ahead to Mecklenburg County Commissioner Pat Cotham. Commissioner Cotham, the microphone's yours.
Thank you very much. And as always, I'm grateful to be on this call, and I'm grateful for all the information that I learned from my colleagues. The information from the county, I think that since we chatted last, we've had some confusion at the county. Just when the governor made his statement, there was a lot of confusion as to the more restrictive Mecklenburg County order. And even today, I see some of my colleagues are still asking the same questions about, they don't understand exactly what it is. But it seems like we're all together. Everything is the same until May the 8th. Now, when that day comes, it might change, and we may stop our local order and just follow the governor's order, and that would be up to the towns to decide that or not. But again, there has been a lot of confusion. There was also the county manager had a business roundtable where she had a wide array of individuals from representing businesses, and including the chambers, the minority chambers, which many of them had 500 to 1,000 members. So they had a telephone introduction. There was, and it was a just among them. There was definitely some pushback in the community that it should have been public, and we haven't really heard any more from. I haven't heard any more from the county manager about a response to that. I had kind of hoped that, and the commissioners weren't on it either. I had kind of hoped that it would, they would maybe work on it, maybe divide them in the two groups with larger corporations and then smaller businesses, and then make a plan and then present it publicly. But there are open meeting laws, and it seems like that the county did not pass that. So I'm looking forward to hearing more, an update on that, but that's still a question mark. There's also, besides the business roundtable, there's we have another meeting tomorrow, and we are going to get an update from the health director, but we're also going to do some of our regular business, which we haven't done for several weeks because it is budget season. So we're going to hear updates from Central Piedmont and the courts, and about what they want and what they are asking for. But I think that our budget is going to have to be much leaner, and because we're not getting the revenue in that we typically do. So that'll be interesting to follow as time goes on. I do want to let you know that the city council, Charlotte City Council, is likely to reach out. I talked to Julie Eiselt this morning. She contacted me. They want to have more spaces for people to walk, because they're having a problem where people in the Charlotte area, the walking area is too crowded. And so they're trying to open up some streets, maybe just let one lane go for cars, or 2 lanes that have part of the road available for pedestrians. And they are likely to contact the town mayors and ask if they would be interested in doing something like this in their towns. And then, but we do have to get permission from the health department for social distancing. I'm just kind of testing the water here. She asked me to do that, to let the town mayors know that she's likely to be calling to see if there's an interest level, and you would select your own areas that you could, if you see this as a problem and you would like to have more areas for people to walk, since there aren't as many cars on the road as in the past. However, I was out on the weekend a little bit and I saw a lot of cars on the road. So I just want to give you a heads up about that. So, I haven't heard anything from the county today. Typically we do hear something by this time, but I'm sure I'll hear later on about any other updates. But that's all I have for today. So that's all.
Thank you so much.
County. Thank you.
Wanda, yeah, very helpful, Pat. Thanks for always being on these calls too. Now we're going to go to the town of Cornelius. Mayor Washam could not join us, but we do have the Cornelius Deputy Town Manager, Wayne Herron, who I had the pleasure of working with very closely when I was back on town council some years ago. So Wayne, we'd love to hear just a quick update from you on what's going on in Cornelius.
Thank you so much, and I appreciate the opportunity to fill in for Mayor Washam and Manager Grant. I'll keep my update brief. On Monday, May the 4th at 8:30 a.m., Mayor Washam and the town of Cornelius will host a virtual coffee chat. The purpose of that coffee chat will be to discuss the local impacts of the COVID-19 crisis. We will also take some time during that coffee chat to review the state's stay-at-home order. We'll talk about the extension to May the 8th and the phased reopening plan. We will also take some time to allow our Chamber of Commerce President, Lake Norman Chamber of Commerce President Bill Russell, to help us in kicking off Small Business Week. And we do want to make sure that we honor our small businesses and let them know we're thinking of them during this time. So we certainly want to kick off Small Business Week, and we'll be glad to have Bill with us during the coffee chat. Any attendees that join us through the virtual format will be invited to submit questions before and during the meeting. We'll have a panel of town and county officials, and we look forward to having that virtual meeting and getting some information out and hearing back from interested stakeholders. That concludes my update, John, and I'd be glad to answer any questions later.
Okay, thank you very, very much, Wayne. Have a great day. Appreciate you jumping in to help. So now we're going to move. You bet. Now we're going to move to the town of Huntersville. Mayor John Annarella, who's also been a mainstay for our calls here. So, Mayor, the mic's yours.
Well, happy Monday to you and everybody watching and listening. I'll start off by saying this is where we are with the stay-at-home order. 2 weeks ago, the towns signed an extension of our former stay-at-home to coincide by date with the governor's, which was April 29th, as well as should the governor extend, the extension automatically applies, obviously, in Mecklenburg County. However, the more restrictive rules that we have in Mecklenburg County also apply. And that has created a tremendous amount of confusion and, quite frankly, unfairness between our businesses here in Mecklenburg County and the rest of the state. In addition to that type of confusion, the North Carolina Department of Revenue has been sending businesses in Mecklenburg County waivers which don't apply because we are under stricter rules and within our ordinance. So the mayors, several mayors and some county commissioners are all trying to get the county to lessen their restrictions to align with the governor's. And we think that will at least clarify and avoid this confusion and then allow probably some businesses to open under the current guidelines. And a perfect example I can give people is the governor mentioned the other day that may or may not have NASCAR running in North Carolina in the next few weeks, and that race shops were allowed to be open under his social distancing guidelines. However, Joe Gibbs Racing, being in Huntersville, is not allowed. And, that's a perfect example of the inconsistencies between the county's rules and the governor's. So hopefully we'll get some clarity on that in the next 24 hours. I do have some good news, though. There's definitely some movement on allowing people to play tennis under some new guidelines put out by the USTA. Also, there'll be some more flexibility for realtors, which I know probably some of you are listening, would be very happy with that. Boat ramps hopefully will be open soon, and county parks for vehicular traffic. Of course, the playgrounds will still stay closed. So I think Mecklenburg County has done a fairly good job at the social distancing. I know Huntersville and North Mech have done a great job. And the reason why I know that, Atrium is opening up for some minor surgeries and things today, and Novant in a few days. And our numbers are flattening, and there are, quite a few less people in the hospital with COVID than were predicted. And I think it's time to get our economy moving and move things forward. So that's all I have, John.
Very good. Thank you so much, Mayor Annarella, and thanks for explaining the orders. I will tell you that I know of a couple of other different businesses that had exceptions from DOR waivers, but then they're still on the non-essential list for Mecklenburg. And if they look just up to Iredale, which is a couple miles away, their colleagues are open, but they can't be. So there's definitely needs to hopefully get some alignment and parity there. So thank you very, very much for joining.
Right.
Now the town of you bet. Town Commissioner Matthew Fort for Davidson was unable to join today's call because of another meeting. He did want me to share that tomorrow night they are having a board meeting, which of course will be virtual. So you can go to this website right here, the Davidson website, and you can tune in and listen remotely if you would like to. Let's see, now we're going to CMS. Obviously, it's a big announcement on Friday. We have CMS District 1 board member Rhonda Cheek on the phone. So Rhonda, would love to hear some updates from you in light of Friday's announcement.
Well, as we all know, the governor announced that school buildings are closed for students for the remainder of the 1920 school year. So that means we are remote for all publicly funded schools, which include the area charter schools and public schools. And from what I've heard, all the private schools are following suit and doing the same thing. So the kids are not going to be in the building. So this poses a whole lot of issues. Number one, how do we feed our most at-risk students? As of Thursday afternoon, we had fed 760,000 meals to go since the beginning of the stay-at-home order. 760,000 meals. Remarkable amount of work being done by staff and by volunteer organizations. We've got people making deliveries to areas that they cannot get out and don't have public transportation. So I'm really just kudos to all the food services staff that is taking care of our most at-risk students. As part of that, they're also delivering educational packets. We've got teachers delivering things. We're just doing everything we can. If you know of a family that is not engaged with their school right now, we still have some that we're making home visits and reaching out to them every way we know, and they're still not participating and engaged. So we don't want them to fall through the cracks. So please let someone know. So I guess the big thing is, as part of this stay-at-home situation and the phasing, we know that one of the big events that comes up in June every year is about 10,000 students graduate from our schools. That is at risk for our traditional graduation. And I'm sure even if we were to have it, we would not be shaking all those hands like we normally do. So beginning tomorrow, there has been a graduation task force assembled by CMS with students, parents, some staff members, no board members, just staff and they are taking input. If you go to the CMS website or my CMS Facebook page, there is a link on there to a Google Doc where people can suggest ideas. I have forwarded a bunch of stuff to people. This is under the direction of Matt Hayes, our Deputy Superintendent for Academics. And before they make a final recommendation, they're going to send out a survey to all seniors and their parents that are connected through the Connect Ed or email systems through the schools, so that parents can weigh in and have some voice in this. So we really want to do something to honor our seniors. As John, you know, I'm a parent of a senior, so this is incredibly personal and important to me, as well as just because of how many kids I care about that are in this school district. So it's a big deal to me to make sure that in some way we're able to honor and celebrate their accomplishments here at CMS before they head off to secondary or careers or the military. So that's our big thing right now. So try to engage in that if you're a parent or a senior student. Get on that Google Doc and give us some ideas. We've heard everything from having it at the Charlotte Motor Speedway, Panther Stadium. People are suggesting all kinds of things, or as much as just a drive up where kids are handed a diploma with somebody with a glove on. So just all kinds of ideas to try to do something to honor these kids. So, but we appreciate this opportunity to get the word out. If there's somebody that is at risk, please have them just reach out to me. We need to get these people connected the best we can, and we need to do our best for kids. I'm sure you heard the other part of the governor's message was he doesn't know when we reopen. That's still the great unknown, and that's very unsettling for 150,000 kids and 20,000 staff members. When do we reopen? I can assure you that staff is looking at every possible scenario of how we may do that, from looking at bus routes with 25 to 50% kids on them in different scenarios. So we're looking at those things, but right now, summer school and the fall are question marks. And the North Carolina General Assembly is meeting this week with some ideas and some recommendations. So we're probably going to see some things coming from them as well. It's just, there's more questions than answers, but some of the answers are now are out there, but they're creating new questions. So we're still working on that question and answer mode. But I appreciate you having me today.
Yeah, you bet, Rhonda. Thank you. And I'm just thinking about Mason and all his colleagues and all other seniors throughout our state and our country. Really, it's unprecedented time. So I hope they can come up with some great ideas. So thanks for sharing that. So now we're going to move on to the Chief Executive Officer of the Lake Norman Chamber of Commerce, Mr. Bill Russell, who's been a mainstay panelist on our calls. Mr. Russell, the microphone's yours.
Thank you, John. We had a fantastic Zoom call with Senator Tillis on Friday with WSIC FM radio 105.9. Senator Tillis was on the line to talk about the recent PPP that had the fourth generation passed, and he talked about the impact on the businesses. And we were able to share with him one of our Huntersville attractions. Carolina Raptors Center was one of the recipients of the PPP, was able to keep their employees there. So we were very grateful for that. We've got a compendium of resources on our website at lakenormanchamber.org. It's a business resource compendium talking about small business assistance, the CARE Act, the PPP, information from our healthcare providers, all that on the website at lakenormanchamber.org. We've also developed a blueprint for going back to work. A task force was just recently mentioned in a couple of callers ago. And we too have put together a task force that is looking at how we're going to re-engage our businesses and making sure that we have a safe environment, not only for the employees, but for the customers, clients that may visit those businesses. We're putting that information together as well. All of this, again, located at lakenormanchamber.org. And we ask that our folks out there continue to support our area restaurants that are open and our area retailers, which will hopefully open very, very soon. John, thank you for these calls, and thank you for putting this information together. This has been invaluable, so we really appreciate this resource.
You bet. Thank you so much, and we appreciate all the support you're doing for your members. Just another quick note here, there is a Huntersville Regional Chamber. There's a website there. We've had an open invitation to them, so just want to make sure you know that's another resource. And then visit Lake Norman. I've heard a lot of great things from this. They have a virtual tip jar for a lot of the workers who aren't working right now. The idea is to leave a virtual tip for someone who normally would receive your tip because you're dining at their table or sitting up at the bar. And every time you visit this website, a new person is featured for virtual tips. So go to visitlakenorman.org and then /restaurants. You can see it right here on your page. But that shows real leadership from our friends at Visit Lake Norman. Just want to thank all of our panelists for being a part of this. Greg Murphy, Congressman, Dr. Faircloth, who's a local doctor, the U.S. Small Business Administration State Director, Thomas Stith, Mecklenburg County Commissioner Pat Cotham, the town of Cornelius, Mayor Woody Washam, and today Wayne Herron, and then John Anarell, the mayor of Huntersville. In Davidson, we've been able to have Commissioner Fort with us a few times. You just heard from Rhonda Cheek, who's the CMS board member, and then of course Bill Russell, the CEO of the chamber, has been on every single call, and it's been my delight to be your moderator, and I'm a former North Carolina House representative. You can find these calls on Elect Bradford on Facebook. Go to Elect Bradford. I post these calls there. Our next briefing will be Wednesday, April 29th. We'll be joined by Director Stith of the U.S. Small Business Administration, and keep your questions coming. LKNtogether@gmail.com. That's LKNtogether@gmail.com. We are stronger together. Take care of yourself. Please take care of each other. Thank you for listening. This does conclude today's briefing call. Thank you.